بسم الله الرحمن الرحيم. نبدأ بالمحاضرة الخامسة our fifth lecture إن شاء الله. بتتكون من includes 3 different microorganisms, of course gram-positive bacteria. First is Cutibacterium acne and then Listeria monocytogenes, and both are rods, non-sporulating rods. And then Bacillus anthracis is our first example of spore-forming rods. We start with the Cutibacterium acne, which was formerly named Propionibacterium acne. يبقى اسمها المعروف يعني الاسم ده اتغير حديثا من Propionibacterium acne to Cutibacterium acne. This is the causative organism of acne اللي هو حب الشباب. وفي الحالات السيفير بيسموه cystic acne. About 85% of all teenagers اللي هو في سن المراهقة may suffer from this acne. This organism, the characters بتاعته is anaerobic, lipophilic, يعني it likes to utilize lipids, عشان كده بنسميها lipophilic. Diphtheroid, commonly found on the skin, so it is considered as a normal flora of our skin. The mechanism of acne formation, it starts usually at puberty اللي هو سن البلوغ، لأن طبعا في السن ده بيبتدي يحصل hormonal change في الجسم. when these hormones known as androgens increase، يعني الأفكت بتاعهم إن هو بيؤدي إلى increase the size and the activity of the sebaceous glands اللي هي موجودة تحت الجلد، resulting in increased sebum production. فبيحصل increase في تكوين السيبم. السيبم ده لما بيتكون بكمية كبيرة بيبتدي يسبب إيه؟ This causes the sebum channels to become blocked. بتتقفل السيبم channels، فبيتحبس السيبم ده جوه في تحت الجلد. فده بيبتدي يؤدي إلى ظهور اللي هي الراس السوداء اللي بنسميها الراس السوداء. يبقى on the skin surface leading to accumulation of the sebum forming a black heads. Then يبتدي بقى دور the role of the microorganism. يبقى ده كله كان بسبب زيادة إنتاج السيبم، فيبتدي يبقى فيه نقط سوداء على الوش. عادة بيبقى طبعا on the face, sometimes on the chest and the back also may be involved. Then the organism tends to metabolize the sebum. زي ما قلنا إن هي it is lipophilic, so it will begin to metabolize the sebum, to converting it to free fatty acids. This free fatty acids will be irritant to the skin, which will cause inflammatory response, leading to the appearance of the pustules, and then if it is يعني severe case بتسيب scars on the face، بتسيب إيه خروم على الوش scars. فهنا ده شكل الأورجانيزم، rods زي ما انتم شايفين small rods، وهنا الانفلاميشن اللي حصلت في السيبيشيس جلاند infected sebum، وطبعا في البروتروجن اللي طالعه دي الانتفاخ ده نتيجه الباس اللي بيملى البوستيول بتاعنا. ودي برضو another pictures showing اللي هو حب الشباب هنا before treatment and then here after treatment. And زي ما قلت it can also affect the chest and the back of the teenagers. A prevention: simply avoid oily based cosmetics. يعني محدش يحط على وشه مواد فيها دهون زي الكريمات في لو كان في if the person is suffering from acne. The idea of preventing إن الواحد يمنع نفسه يعني إن هو ياكل certain food like chocolate proved to be non-significant effect, has no significant effect. يبقى الدايت مش بيأثر قوي، doesn't affect قوي on the case of acne. التريتمنت topical benzoyl peroxide. This help in drying the pustule، بتنشف البوستيول فبالتالي بتساعده ان هو يقع، and has also antibacterial effect. Antibiotics in cream example erythromycin or clindamycin، واخترنا دول بالذات because انهم بيأثروا على الانيروبيك بكتيريا. tretinoin اللي هو الريتين A أو فيتامين A برضو is useful. دي كلها topical preparations. بس it is not advisable to use topical benzoyl peroxide together with tretinoin at the same time because they may inactivate each other. So it is preferred to use them at different times of the day. في اوقات يعني في واحد تستخدم حاجه الصبح مثلا وحاجه بالليل، لو عايز تستخدمهم الاثنين ما تستخدمهمش مع بعض في نفس الوقت عشان ما يحصلش inactivation. Isotretinoin دي في السيفير cases can be taken orally, but it has certain limitations that it is teratogenic. فلو كان في suffering is a pregnant woman, she's not supposed to use this medication. في نيو بقى prescriptions زي الدابسون جel 5% دابسون gel. دابسون ده is mainly used to treat leprosy. فfound that this medication gel 5% is good for has an antimicrobial anti-inflammatory effect for this organism أو في الحالة بتاعتنا. Finally, laser and light therapies علاج بالليزر show promise in acne treatment, but of course it is a bit expensive. ننقل بقى على the second microorganism اللي هو Listeria monocytogenes, and we consider it as a zoonotic bacteria because it is usually present in the GIT أو it's a resident يعني a normal flora in the GIT of many animals, especially domestic animals. It's the causative organism of listeriosis. يبقى المرض بنسميه listeriosis. ملوش ترجمة عربي، معرفش ترجمته بالعربي الحقيقة. Listeria monocytogenes is a normal resident of the GIT of many animals, as I said. سموها ليه monocytogenes? Because the infection in some animals is accompanied by monocytic response. بيأثر على المونوسايتس أو الماكروفاجز as we will see in its infection cycle. Listeriosis has many clinical forms. هنلاقيها بتعمل infections في أماكن كتير في الجسم. ولكن the most frequent is meningitis. يبقى أكتر حاجة منتشرة في this organism that it causes meningitis. the more characteristic كمان, the most characteristic for it is the infection of the genital tract of a pregnant woman, thus infecting the fetus. يبقى the woman, if she is pregnant and get infected with this organism, ممكن تنقل بسهولة. This organism can be transmitted to her fetus while still in her uterus, because it's one of the few pathogens that can pass the placental barrier. But it also can infect the baby during delivery through the birth canal. He can get the infection from his mother. So this is very characteristic. دي حاجة خاصة جدا بالميكروب ده. Now we're going to speak about the morphology and characteristic. We can recognize something. نلاحظ حاجة in this organism. It is a bit confusing. And it was not known from long ago. It was until recently unrecognized because it has features from every microorganism. Let's see. أولاً, it is short gram-positive rods. Non-spore occurring in short chains of 3 or 5 organisms. Because it is short rods, you can يعني تتلخبط بينها, be confused between the rods and being cocci, and it is present in chains. So you can consider it as a streptococci, for instance. If stained, they assume a typical dipteroid arrangement, which is the Chinese letter arrangement, and this is like corine bacteria. They are beta hemolytic, aerobic to microaerophilic, catalase positive. Catalase positive يبقى like the staph. We know the streptococci is catalase negative. They do not ferment mannitol. It is not staph. So if someone wants to diagnose this organism, it was really زي ما قلت يعني بتلخبط, confusing, till they discovered it is a new microorganism which is called Listeria monocytogenes. The characteristic features of this organism is this point. At temperature 20 to 25, it is actively motile by many peritrichous flagella. يبقى at room temperature, which is about 20 to 25 degrees, it possesses many flagella surrounding its cell, اللي هي بنسميها peritrichous flagella، اللي هي بتحيط كل السيل وول. حوالين السيل وول بيبقى فيه flagella، ودي اللي بتعمل الموفمنت اللي بنسميها tumbling movement. At 37 degrees centigrade, يعني at the temperature of our body, they only possess one polar flagella. And this is used to differentiate it from the corine bacterium. يبقى دلوقتي أنا بفرق بينها وبين الcorine bacterium. الcorine bacterium is non-motile زي ما أخدنا. But here it is motile. So by this I can differentiate between it and between corine bacteria. It grows over a wide range of temperature. This is برضو something very specific. From 0 degrees to 50 degrees. It can withstand a refrigerator كويس جدا. It can grow in the refrigerator, and we can see here in this curve the optimal growth at 4 degrees centigrade, and minus 20 it is still living. So it can withstand cells a very big range of temperature. Let's see بقى the mechanism of pathogenesis of the Listeria monocytogenes. We'll see the antigens and the virulent determinants. The organism أولا has been divided into 13 serotypes according to the surface lipoteichoic acid. This lipoteichoic acid بيعمل causes confusion، يعني بيعمل عملية لخبطة. نتلخبط بينه وبين إيه؟ It confuses us with the lipopolysaccharide of the gram-negative bacteria. ودي من ضمن الحاجات اللي أنا قلتها في الأول إن this organism بيتشابه أو بيلخبطنا بين other microorganisms. At least 90% of clinical listeriosis is caused by type 1A, 1B, and 4B. يعني في 3 serotypes هم أكتر 3 serotypes are منتشرين are spread causing clinical listeriosis. The 4B type is considered the epidemic strain. بعد كده في virulent Listeria monocytogenes also produce a protein known as siderophores. These proteins allow the organism to mobilize iron from the human transferrin. ده بيؤدي إلى إيه؟ يؤدي إلى accumulation of the iron in the body. And as you know, the iron overload suppresses the immune system لأنه suppresses chemotaxis and phagocytosis. طب ده بيساعد البكتيريا في إيه؟ This helps the bacteria to be spread in the body and causes the disseminated disease. The key بقى virulent determinants are believed to be Listeriolysin O and phospholipases. Listeriolysin O is a hemolysin. بس now we'll see إن هو ليه another very important role in the pathogenesis of Listeria. Rather than being a hemolysin، يعني إيه hemolysin؟ يعني طبعا destroys the RBCs. But it also has another very important role together with the phospholipases, A, B, and C. Both of them cause the lysis of the phagolysosome. Of course, you know, after being phagocytosed, the bacteria will enter in a phagosome, in the macrophage, for instance, and then there will be fusion between this phagosome and the lysosome. فبيحصل تكوين the production أو يعني formation of the phagolysosome اللي inside المفروض البكتيريا will be destroyed by the lysosomes الانزيمز اللي موجودة في السيل. هنا بقى the bacteria can escape this by causing the lysis of these phagolysosomes, so enables the bacteria to escape to the cytoplasm. D, Act-A protein. This is a surface protein that mobilizes and polymerizes the actin filaments of the host cell, converting it to an actin capsule surrounding itself, surrounding the bacteria. يبقى بتحيط بنفسها with this actin capsule and forms also a long polymerized actin tail, which appears at one end of the bacteria, and it helps the bacteria propelling itself or moving easily in the cytosol of the macrophage. Let's see the Listeria infection cycle. أول حاجة نحب نعرفها in this organism we want to know that it is a facultative intracellular organism. What does this mean? Means that it can live inside the cell, of course, and also it can live outside the cell. So it is not an obligate intracellular parasite. The key to the pathogenicity of the organism is its ability to multiply within the unstimulated macrophages or even any parenchymal cells. This infection cycle represents حاجة بنسميها إيه؟ parasitophagy. Parasitophagy, to know the meaning of this word, the part para means nearby, cyto means cell, phagy means eating. So it means two neighboring cells eating from each other. وده اللي هنشوفه in the infection cycle, and this we were going to see in the infection cycle. Of course, what are they eating? They are eating the microorganism. So let's start here in this figure. Here is the bacterium with the color اللي هي لونها turquoise. And this is a macrophage or parenchymal cell. أول step طبعا هيحصل phagocytosis of the bacterium entering the phagosome in the vacuole inside the cell. Then fusion will occur between the phagosome and the lysosome. Then the bacteria will begin to produce, to release the Listeriosis O and the phospholipases, which will تعمل ايه بقى؟ تعمل lysis، تبتدي تكسر الفاكيول، بتعمل lysis للفاكيول. So the organism will be liberated outside the vacuole. And هينتشر بقى in the cytosol أو the cytoplasm of the cell. Once it is outside the vacuole, it begins to multiply. زي ما انتم شايفين كده, as you can see in the picture, the bacteria multiplied here, and then it begins to produce the Act A protein, which mobilizes and polymerizes the actin filaments in the cell, forming a capsule surrounding the bacteria. As you see the red color around this bacterium, and forming also a long polar tail. This tail will help the bacteria to move freely in the cytoplasm. While it is moving in the cytoplasm, وهي بتتحرك بقى freely in the cytoplasm والpolar tail ده اللي احنا قلنا عليه اللي بيحصل بيتكون at 37 degrees centigrade اللي هو the temperature of our body. بيحصل ايه بقى؟ ان البكتيريا كان تخبط والبump to the side او to the cell wall of the parenchyma or the macrophage. it forms a pseudopod. يبقى ما بتخبط في الجدار of the خلية بتاع الخلية بتكون a pseudopod when it bumps itself to the edge of the cell or the cell wall of the cell. And as you see here, this pseudopod reached a neighbor macrophage. So the bacteria can enter by this way into the neighbor cell, forming a new phagosome or vacuole. As you can recognize here, تلاحظوا إن this vacuole is double membrane vacuole. هنا كان الvacuole only one membrane. هنا a double membrane vacuole is formed. اللي هي double ليه؟ Why is it double? Because one is of the previous cell and the other is from the new cell. وبعدين the life cycle will go on. The organism will برضو produce the Listeriosis O and the phospholipases, so they will cause the lysis of this membrane, of this vacuole, coming out, multiplication, forming the capsule and the tail, and so on. It will continue its life cycle. Therefore, in this way, the Listeria organism moves directly from cell to cell without passing through the extracellular space, protecting itself from complements or antibodies. يبقى it will بتحمي نفسها من immune system. It also can protect itself from treatment by antibiotics. Okay. Here you have a video. You can see it إن شاء الله. أنا هبعته مع مع المحاضرة I'd like you to see it. هتوري لنا برضو it will show you the Listeria infection cycle. Epidemiology. Listeria monocytogenes is widely distributed in nature. And as we said, it is a primary and animal pathogen. And however, it has been until recently frequently unrecognized. دلوقتي احنا فاهمين we can understand ليه بنقول كده. لأن زي ما قلنا إنها المورفولوجي بتاعها can be similar to other bacteria. حتى ال clinical manifestation is not highly characteristic في ال symptoms بتاعتها. About 2,500 cases of listeriosis are reported in the United States yearly. كل سنة، بس هي مش منتشرة in Egypt لغاية دلوقتي الحمد لله. This kind of infection مش منتشرة in Egypt، وهي عادة it is more in the cold regions in the world يعني. Mostly it is occurs in newborn infants, in pregnant women and elderly. لأن دول طبعا عندهم الاميونيتي بتاعتهم بتبقى ايه؟ بتبقى low immunity. والpregnant women as we said بتبقى very liable إنها تنقل the infection to her fetus. Patients with deficiency in the T-cell immunity, especially T-cell immunity, because as we saw that this organism is intracellular. فالimmune system responsible for intracellular organism is the T-cell immunity. So people with deficiency in this cell immunity are at great risk. Example, AIDS patients. Listeria monocytogenes is a sporadic disease. يعني مش منتشرة قوي. It is a sporadic disease. The infection may be acquired from domestic animals زي ما قلنا الدوجز والانيمالز اللي ممكن يتربوا في البيت. Recently, food is considered the most common vehicle for infection. ايه انواع الفود types of food which can be contaminated with this organism, like the shrimps اللي هو الجمبري, البولتري اللي هي كل الطيور, الجراوند بيف اللي هي اللحمه المفرومه, dairy products اللي هي منتجات الالبان ومنتجاتها زي الجبن and so on, or from vegetables fertilized by contaminated manner. او ممكن تيجي حتى من الخضار، يعني دي كلها sources animals. لكن ممكن تيجي كمان من الفيجيتابلز. الفيجيتابلز امتى هتبقى contaminated with this organism? when it is fertilized، يعني عملية السماد بتاعها تتسمد ب contaminated manner. يبقى الفيرتلايزر جاي من الحيوانات، اللي هو السماد جاي من الحيوانات، فبيبقى الحيوان أساسا عنده infection. The animal is infected, so in turn, his feces will contain the microorganism. If these feces are used as a manure, as a fertilizers on the land, they will contaminate the vegetables, such as the lettuce and the cabbage. اللاتس طبعا اللي هو الخس، والكابج اللي هو الكرنب. Especially the lettuce and the cabbage because they are eaten raw without being cooked. Here in 1981 in Canada, as I said, دايما كندا طبعا الجو فيها it's very cold place. In Canada, they reported an outbreak due to coleslaw. Coleslaw, it is a kind of salad made of cabbage. And of course, it is served cold. It is not heated, أو يعني ما بتطبخش, not cooked. It is easily contaminated with the organism, especially if this cabbage was fertilized by a contaminated manner. Here, this chart shows reports of contamination with the listeriosis over a certain period of time from 1990 to 2004. Here, this picture shows the food, kinds of food which can be contaminated with the listeria. A salad, shrimps. Here is the dairy products like the cheese, like the milk, البولتري زي احنا قلنا الطيور زي الفراخ chickens, and هنا اللانشون الهوت دوجز etc. Clinical picture. Listeriosis can mimic and can be similar to several infections. 55% is meningitis. يبقى it manifests itself 55% as meningitis. It is the most common manifestation, especially in renal transplant recipients. اللي هم الناس دول أكيد واخدين حاجات to depress their immunity, ف they are liable to get the infection. طب what about if a person is with good immunity? Isn't he infected totally by this organism? No, he can be infected, but it will manifest itself as a common cold. زي ما يكون واحد جاله شوية flu وخف without any treatment. So it will be very mild لو الشخص عنده good immunity. It also, يبقى إذا meningitis is the main manifestation, but it also can cause bacteremia, endocarditis, urethritis, conjunctivitis, and abortion and stillbirth. But most infections occur in newborn. يبقى أكتر انتشارا this infection is in the newborn, as Listeria monocytogenes represents one of the few pathogens that can pass the placental barrier. Usually this listeriosis occurs, especially the early onset, when the mother has been infected during delivery, not before becoming pregnant. The infection must be during delivery عشان يحصل infection to the fetus. So we divide the neonatal listeriosis into two forms. The early onset, in this case, the infant is caused by pneumonia. يبقى الديزيز هنا manifests itself as pneumonia, التهاب رئوي, at birth, يعني بعد الولادة على طول. Or after بالكتير قوي 2 days of life. يبقى إذا occurs directly after birth, or after birth with 2 days هيبتدي symptoms appear on the child as pneumonia. The infection is acquired either in the uterus زي ما قلنا وهو لسه ما اتولدش, يحصل organism passes through the placenta, through the placental barrier and reaches the fetus, or from the vagina. And in this case, it can appear after 2 days of birth at time of delivery. This type is caused by serotype 1A or 1B with high mortality rate, which may reach to 50% mortality. In late onset, and we can consider this epidemic form, it occurs 1 to 4 weeks after birth. هنا الانفكشن ما بتجيش from the mother actually, it is not from the mother, ولكن it is nosocomially from the hospital. It will be seen as meningitis at this time, caused by serotype 4B اللي احنا we called it the epidemic strain. If you memorize, أنا قلت عليها epidemic strain. Infection acquired after birth, where the mortality rate may reach up to 20%. Laboratory diagnosis. The specimen include the blood, cerebrospinal fluid, amniotic fluid, or genital tract secretions. We will apply gram staining. 20% tryptose agar media is good for cultivation. And as we said before, it is catalase positive, causes meta-hemolysis on blood agar. دي كلها حاجات not very highly characteristic. characteristic بقى test اللي هي tumbling motility at room temperature اللي هي حركة البيريترايكس flagella. In food samples by monoclonal antibodies can be detected. The microorganism can detect by monoclonal antibodies from the food. This is a characteristic test called Anton's test. This is test for the virulence of the organism. A sample from a 24-hour culture of the organism is dropped into the conjunctival sac of a young rabbit or guinea pig, which will show severe purulent conjunctivitis after 24 to 36 hours. يبقى الimportant test هنا بالنسبة للlisteriosis اللي هي الtumbling motility هي اللي عاملها لكم بالأحمر, والأنتون's tests. I write it in the red color because these are the characteristic tests you must know in the laboratory diagnosis of listeriosis. The treatment and control, of course, antibiotics. Example, ampicillin or trimethoprim sulfamethoxazole. In case of penicillin, this is for penicillin sensitive patients. Ampicillin for penicillin sensitive patients. Being intracellular organism, a treatment is difficult. This is a note يعني. You have to تلاحظ أو تاخد بالك and it is difficult to treat this organism because it's an intracellular organism. No vaccine is available till now. يعني في researches بتتعمل ما زالت but till now there is no available vaccine. However, careful attention in handling infected infants in neonatal units is very important to prevent the nosocomial transmission. The susceptible person should be isolated from cases of listeriosis. Of course, pregnant women must be advised to avoid eating uncooked food. As we said, the coleslaw ممكن ينقل this infection or any uncooked food. Gram-positive spore-forming rods. Start بقى with spore-forming rods. Number 1, Bacillus anthracis. This is the causative agent of anthrax. اللي هي بالعربي اسمها الجمرة الخبيثة. This is one of the occupational diseases. يعني الأمراض المرتبطة بمهنة معينة with a certain job. Anthrax is a Greek word for coal. coal اللي هو إيه؟ الفحم. يبقى ليه؟ Because as the center of the anthrax pustule الكالر بتاعه بيبقى black زي لون الكول like the color of the coal. وحتى كلمة الجمرة الخبيثة، الجمرة اللي هي إيه؟ اللي هي الكول المشتعل اللي هو الفحمة المشتعلة دي بنسميها الجمرة. ومن هنا جت برضو التسمية الجمرة الخبيثة. This organism is of historic interest. ليه أهمية تاريخية؟ Because it is the first organism to be known and isolated by the first أو واحد من الأوائل في الميكروبيولوجي اللي هو الجيرمان bacteriologist اللي هو روبرت كوخ 1877. This scientist أو bacteriologist Robert Koch, this is his picture, and by the way this is his wife. ليه أنا حاطة يعني صورة مع his wife? Because she was the one who brought for him a gift which was a microscope. هي جابت له هدية الميكروسكوب، ومن الميكروسكوب بتاعها هو بدأ to examine the microorganisms and he discovered the bacteria. And طبعا he is responsible for the well-known Koch's postulate. Koch's postulate بتقول إيه؟ It denotes that if an organism is separated from an infected animal, then injected into another animal, and if the later suffered from the same symptoms, يبقى إذا أطلع بconclusion إيه؟ إن the organism can be grown in artificial media. طبعا it seems يعني a bit silly this postulate, but at that time it was a big discovery. لأن ما كانش حد عارف لسه إن في حاجة اسمها بكتيريا. It was something invisible for the people to identify a bacteria without the microscope of his wife, of course. So when he discovered the bacteria and he knew that it is the cause of the disease, اكتشف إن المرض ده اللي ظاهر قدامه كان on the animals، لأن طبعا الأنثراكس ده كان يصيب الأنيمالز. Either he could transmit the organism اللي هو invisible to us by our naked eye, of course, to the new other animal, a normal animal. The new one suffered from the same illness. Then he concluded that there is an organism who did this infection and I can grow it artificially outside in an agar plate, for instance. Of course, this postulate has certain limitations because not all microorganisms can be cultivated artificially. مش كل البكتيريا ممكن أزرعها artificially. زي هنشوف example Mycobacterium leprae. It cannot be cultivated artificially. But at that time, it was a very big discovery. Now there is تجديد أو يعني a new postulate. We called it molecular and they kept the name Koch. يعني احتفظوا باسم كوخ برضو على this postulate بس طبعا مش هو اللي عامله. This new molecular Koch postulate denotes what? It describes the cause of infectious diseases on gene level. So here we say that virulence is due to a certain gene. It's on gene level, so I'm going to consider that this gene is the responsible for the virulence. So if inactivated, this gene is inactivated, the organism loses its pathogenicity. If reversion occurs, it leads to restoration of the virulence. So this is the new form of Koch's postulate, and we call it molecular Koch postulate. نرجع بقى للمرض بتاعنا اللي هو نشوف المورphology and characteristics of this Bacillus anthracis. It is a large boxcar-shaped gram-positive bacilli. It's facultatively anaerobic. يبقى إذا إحنا دايما بنقول الكلمة facultatively anaerobic يعني it is ميالة to be إيه aerobic but can withstand anaerobic conditions like we said when we were speaking about staph in our early lectures. It is encapsulated. طب how come it is spore forming and capsulated at the same time؟ احنا هنقول دلوقتي it forms spores او احنا قلنا it's a sporulated bacteria. It is non-motile and forms parallel chain. يبقى الارينجمنت بتاعتها parallel chain. It forms spores زي ما بقول. How can it be encapsulated and form spores at the same time? Spores is formed under unfavorable conditions in vitro. When the organism is in the soil, it is converted to spores. It forms the spores. But when it enters the body, the human body, it loses the spore أو بنقول منها حصل لها regermination and then it forms the capsule. لأن الكبسول will protect it from the immune system in our body. And the spores protected from the drastic conditions in vitro, in the soil for instance. يبقى it forms spores which resist destruction and remain viable in soil and in animal products like الفيسز يعني for decades. Like feces and we'll say هنشوف كمان other products of animals. Bacillus anthracis could be a major agent of bacteriological warfare. يعني ممكن استعملها في ايه؟ كسلاح في الحروب اللي احنا بنسميها biological weapon. biological weapon لانها بتستعمل في الحروب. السبورز are highly easily transmitted بسرعة جدا and can cause السيمبتومز اللي هي ممكن تبقى ايه؟ fatal sickness of anthrax. There is only one antigenic type. Epidemiology. Of course, the disease anthrax is a very old disease, قديم جدا وكان موصوف. It was described in the old history of the Egyptian history. في القدماء المصريين كانوا بيوصفوا ان حصل killing للإيجيبشن كاتلز since 1491 BC يعني قبل الميلاد. And they were describing this disease causing the death of the Egyptian cattle. The Middle East عموما has been a repeated source of infection. Anthrax is primarily a disease of lower animals. Example الشيب, الكاتل and the goats. طبعا مفهوم يعني ايه sheep يعني الخرفان والكاتل اللي هم العجول والجوتس اللي هم ايه المعيز. In man it is primarily an occupational disease confined to those who handle animals or animal products. اللي بيتعاملوا مع الانيمالز نفسها او البرودكتس بتاعت الانيمالز ممكن you can get the infection. طب ايه هي الانيمال products such as hair and hides. الهايدز اللي هي الجلد بتاع يبقى الفرو والجلود بتاعت الحيوانات. The bacilli leave the body of the infected animal in the feces and urine. يبقى mainly the bacilli is present in the feces and the urine of the animal, which can contaminate the hides easily and the hair of the animal, and then it can reach the man. Man can acquire infection through three main portals بثلاث طرق. Through wound or abrasions of the skin, and we call this infection طبعا cutaneous form of anthrax. Or through inhalation عن طريق التنفس of the dust containing the spores. يبقى التراب ممكن يحمل السبورز فيجي عن طريق الاستنشاق. Through inhalation, and this will endangers those who handle dry hides and wool or hair. اللي هو الصوف او الشعر او الشعر، ممكن الشعر بتاع الحصنة او الدراي هايدز اللي هي الجلود. And this will give rise to the pulmonary form. Finally by ingestion، ان الواحد ياكل حاجة contaminated بالسبورز. طبعا الاكل هيكون mainly الميلك or الميت، يبقى contaminated milk or insufficiently cooked meat, and this will give rise to the intestinal form of infection. And this is the cycle of anthrax, that here is mainly from the animal, and from the animal it goes to by inhalation or through ingestion to a man, or through cutaneous زي ما انت شايف هنا في a cut in his hand، يبقى في عندنا cutaneous أو by inhalation أو by ingestion. And sometimes it can be facilitated by a fly, a biting fly, and it can برضو bite the man and تعمل transmission للinfection to the skin of the person. يعني by a bite of a fly or by any cut or incision in the hand or in the skin. يعني. The mechanism of pathogenicity. A polypeptide capsule, and this capsule, the virulent organism depends in part upon the antiphagocytic activity of this capsule, of course, as any capsule, which protects the organism from antibodies and complement. Number 2, الانثراكس toxin. طبعا ده أهم حاجة, the most important, الانثراكس toxin. Bacillus anthracis secretes a very toxic exotoxin. Although it was missed for many years, ما كانش معروف التوكسين ده for many years. ليه؟ Because the toxin is not liberated or even produced in vitro. يبقى البكتيريا doesn't produce this toxin if it is in vitro. So that's why it delayed بقى the discovery of this toxin. اكتشاف التوكسين ده اتأخر شوية نتيجة كده. The toxin is encoded by a plasmid. يبقى إذا the plasmid موجود في البكتيريا، يبقى هنا it is not lysogenic. بمعنى آخر it's not lysogenic، ده البلازميد موجود في البكتيريا نفسها. It consists, the toxin is composed of 3 components. احنا اتعودنا على الاكزوتوكسين to be an AB subunit. هنا عندنا ال A subunit is 2 subunits اللي هي الإديما factor and الليثال factor. يبقى both represents ال A subunit. يعني that is to say they are the active or the toxic subunit. A protective antigen represents the binding subunit. Okay? So of course, without the protective antigen, both the edema factor and the lethal factor could not exert its toxic activity. The irrigation factor والlethal factor have no effect alone. الكلام اللي لسه بقوله دلوقتي. They both need a protective antigen which acts as a carrier protein that binds to the receptor on the host surfaces. The toxins causes what بقى? The signs of the disease, of course, which manifests itself as edema factor, فهتسبب الإديمة. الهيموريدج it's edema factor. أنا قلت elongation factor أنا غلط. It's edema factor, hemorrhage, capillary thrombosis, and it also has an effect on the CNS. It depresses the CNS, result in acute respiratory failure, and this طبعا which may cause death. نشوف a clinical picture. There are 2 main forms. يا إما cutaneous infection, it's number 1, or بقى internal form. Here there is, we call it has another nomenclature. بنسمي cutaneous infection malignant pustule, or another name it is known from long ago as Hyde-Porter's disease. Hyde معناها الليذر اللي هي الجلود. Porters يعني هو carry the hide، يعني اللي هم الحمالين اللي بيشيلوا الهايد، فعشان كده سموه Hyde-Porter's disease. The incubation period from 3 to 5 days. It begins as a small hard lesion which the patient first noticed due to pruritus. يبقى الشخص بيبتدي يحس ان في منطقة على جلده بتهرشه، itchy. يبقى the patient begins to feel the area by being itchy. Okay, اللي هي pruritus. Then a small vesicle develop in the center. The center of this lesion يبتدي يكون a vesicle. The area increases in size. يبتدي الاريا تكبر، الليجن توسع. And يبتدي يحصل فيها ايه؟ swelling. And the surrounding tissue swells. The vesicle rupture after time with discharging a clear fluid and reveals بقى البلاك necrotic central area اللي هي known as eschar، اللي هي زي ما واضحة طبعا في الصورة، الجزء الأسود اللي هو منه سمينا المرض ايه؟ anthrax أو coal-like. فالجزء اللي في النص ده بيبقى لونه black because it is necrotic. Then after 1 to 2 weeks الاسكر loosen and separate، بينفصل عن الجسم، بيقع leaving a permanent scar. يبقى بيسيب بقى scar على الجلد، بتفضل موجودة مكان الليجن. الليجنز are not painful، وعادة بيبقى فيه one single cutaneous lesion زي as we see in this picture is typical. ولكن sometimes it develop multiple discrete lesions. هنشوفها في الصورة اللي جاية دلوقتي. If the lesion is not treated, the organism invades the regional lymph nodes and the blood and then cause death. يبقى إذا لو أنا ما اتحكمتش في المرض اللي هو الcutaneous form ممكن يحصل complication والorganism reaches to the blood and the lymph nodes and then cause death. يبتدي يأثر على CNS ويعمل الdeath. Here, this is the cutaneous anthrax showing multiple discrete lesions. زي ما انتم شايفين هنا دي تقريبا R وفيها الليجنز كذا ليجن على the same R. الانترنال فورمز بقى بنقسمهم لنوعين، two types، يا اما pulmonary anthrax او برضو ليها تسميه well known from old times اللي هي الwool sorters disease. wool sorters disease بمعنى طبعا الwool اللي هو الصوف، sorters اللي هم بينقبوا في الصوف، اللي هم بيشتغلوا في الصوف. فطبعا الصوف بيبقى dry، the wool is dry, and if it is contaminated with the spores it is easily spread in the air and easily inhaled by the persons. فعشان كده from this we call it wool sorters disease. It is less frequent but more serious. The initial phase begins as cold، يعني as common flu، زي الفلو في الأول common cold for 2 to 4 days. Then the patient show even signs of improvement، الشخص يبتدي يتحسن، وبعدين suddenly بيحصل then sudden onset of acute phase begins as severe respiratory distress، اللي هو بيبقى ايه؟ بيبقى حصل ان التوكسين وصل للسي ان اس فيحصل severe respiratory distress which leads to death within 24 hours. وطبعا هما ما بيستعملوا this spore as warfare weapon، زي كسلاح بيولوجي، بيعتمدوا على this type of infection اللي هي بتبقى عن طريق الايه؟ الانهيليشن of the spores. في gastric anthrax هنا الأورجانيزم will enter through the blood by eating contaminated food from the intestine and then it will reach also to the lung to cause fatal pneumonia. Immunity, once having had a cutaneous lesion there is a degree of immunity. الجسم ممكن يكون specific antitoxins ل this kind of disease اللي هي cutaneous form. But there is no detailed data concerning immunity following pulmonary anthrax. ليه؟ due to أولا rarity إنها قليل لما بتحصل، وأكتر إن هي high mortality rate. فمعظم اللي بيجي لهم pulmonary anthrax للأسف بيحصل لهم death، فبالتالي there is no reports about their immunity otherwise أو afterwise. Laboratory diagnosis: the organism is isolated from cutaneous lesion or pleural fluids in case of pulmonary disease and cultivated on any nutrient media. لأن الأورجانيزم ده عامل زي الباسيلس ساتيلس اللي هي موجودة عندنا في المعمل بتشوفوها، يبقى it can grow easily on any routine media and can be gram stained. But of course you can differentiate between it مثلا and between bacillus العادية الساتيلس which is non-pathogenic. It's the same morphology. Serum samples can be tested for 4-fold increase in titer of the hemoagglutination antibodies, or we can carry ELISA. to make it easier for you, such laboratory diagnosis will never تيجي in your tests because it is very non-characteristic. فيعني laboratory diagnosis هنا في الانثراكس is not very important. The symptoms are very characteristic, of course. Prevention and control. Number one, isolation of the patients and the dressing of the external lesions should be burned. السبورز هنا can live زي ما قلنا very easily في حاجات non-living sources في السويل في اي مكان هتعيش. فاذا مهم قوي لما يبقى عندي الكونتاميننت بتاعي او الانفكشس ايجنت بتاعي is spores يبقى لازم فيه precautions جامده قوي for the prevention. يبقى اول حاجه patient, the dressing and the external lesions of the patient must be burned. If it is infected animals, of course should be isolated. The dead bodies بقى of the animals shouldn't be opened for autopsy. ان احنا عايزين نشوف ايه سبب الوفاة، لا. بالنسبة للحيوانات we never make autopsy but must be completely burned. نحرق الجثة and packed with lime and buried تدفن at least 3 feet under the ground عشان ما يحصلش ابدا انتشار للspores. Of course we have to avoid using milk or meat from infected herds. الهايدز اللي احنا هنستعملها في certain industry والhair والshaving brushes should be sterilized. طبعا shaving brushes nobody now is using shaving brushes اللي هي كانت بتستعمل زمان from the hair of animals. Prophylactic vaccination of animals. It is a living attenuated vaccine which gives long-lasting immunity, which is known as anthrax vaccine. And this vaccine is the first vaccine to be discovered by Pasteur, طبعا the well-known برضه microbiologist اللي هو Louis Pasteur 1881. So he was the first one to discover the first vaccine to protect the animals in France. He of course is a French scientist, so he was able to rescue a large amount of animals لو كان بيجي لهم anthrax and they were dying by this vaccine. For human, طبعا we can't give this vaccine to human. It is attenuated, so it is dangerous for human beings. So for human vaccine, for people at risk or in case of danger of using the spores as a biological weapon, we use alum precipitated protective antigen. But it needs annual boosters, needs booster doses every year. And it's made from a part of the toxin اللي هو protective antigen. بيعملوا له inactivation by alum precipitation and we form from it يعني بيكون منه human vaccine. Produce from it the human vaccine. Treatment of anthrax. Penicillin is the drug of choice. However, lately they recommend also ciprofloxacin. So at the end, في النهاية بقول لكم in this disease اللي هو الانثراكس disease now is a rare disease, rarely infecting cattle or any other animal or even humans. But the danger of this disease إن احنا ندرسه, we have to study it because of its use as a bioweapon. استعماله as a bioweapon هو اللي بيدي خطورة للمرض ده لغاية النهاردة. As you see here in this picture, this letter is not a love letter. ده مش جواب غرامي. This is an anthrax letter. What do we mean by anthrax letter? قصدنا ايه بالanthrax letter? These letters were spread كانت منتشرة in the United States في أمريكا after the attack, the 9/11 attack. أكيد تكونوا سمعتوا عن ال 9/11 attack اللي هي سنة 2001, the year 2001 اللي حصل attack on the Trade Center and the Pentagon in the United States. After this attack, these kind of letters were spread in the nation في أمريكا. حتى you can see here the address is written here, Washington, D.C. So these letters were sent by certain people. Nobody knows until now. محدش عارف who really sent these letters. But they were spread in the nation. طبعا this made the people to be more panic. الناس بقت خايفة قوي يفتحوا الجوابات بتاعتهم ألا تكون فيها these تكون anthrax letters. These anthrax letters contains a powder like for instance talc powder mixed with the anthrax spores. So who opens the letter, أي واحد هيفتح الجواب, he will inhale, هيتنفس the spores, giving rise to the pulmonary form of anthrax, which, as you know, is the most serious type, and of course it is very fatal. By this we end our lecture. Good luck, وإن شاء الله نتقابل in our next lecture next week بإذن الله. Thank you.